Welcome, everyone. I am so excited to introduce you to my guest today, Gerry Langan. As you know, I am on a journey to collect the stories and the voices of those who are involved in the pulmonary hypertension community. And I'm doing this in honor of my mother. When I tell you that you are in for a treat today, Gerry is absolutely amazing. And I shared with her before we logged on, and I'll be transparent, that I have heard her story and it just makes me cry because it's beautiful. And I'm just inspired. So Gerry, welcome today. Thank you for being here.
So much for having me.
So I want to start out for our viewers, just tell me who is Gerry, just in general, before we get to your PH journey.
I am 32. I don't know. I have to ask my husband all the time. I stopped counting after 28. So like I have no idea how old I am. I think I'm 32. I think I'll be 33 this year.
When's your birthday?
In 1989.
No, like your actual birthday, like what month?
Oh, November.
November what? Oh, I'm November 8th.
Hey. I am a military wife and a mom to twin boys. They are 4, so they keep me busy. And I also am in marketing. I do content creation and copywriting for a school. And then I also do patient advocacy and patient consulting. So I'm kind of busy.
All right, so after you said content creation, your volume went out a little bit. So go back and tell us that part again. You do content creation?
I do content creation for a disabled clothing brand. Okay. And I also am a patient advocate and patient consulting for pharma.
Awesome, awesome. So tell us about your pulmonary hypertension journey, maybe from like before diagnosis, you know, what life was like, and just kind of help us to understand your journey.
Sure. I was diagnosed in 2018. The boys were born in the summer of 2017, and my husband got orders for Colorado about 6 months after the boys were born. So we relocated to Colorado 6 months later. So in like January or February of 2018, we relocated from sea level in North Carolina to high altitude in Colorado. And while we were transitioning, I was having a hard time with like altitude sickness. So a lot of the symptoms that I was having that leading up to getting diagnosed looked a lot like altitude sickness, but also, you know, I had just had the boys and I gave birth. I actually gave birth and didn't have a C-section. So I had a lot of postpartum issues. I also had a postpartum hemorrhage. So, you know, my body was pretty rocked after pregnancy and after giving birth. So there were a lot of things that were like kind of happening, but like none of them looked too different from what people, especially moms, go through, especially postpartum. Like my body was very tired. I'm, you know, a mom of newborn twins. Like I'm exhausted. We just moved to from sea level to high altitude. So I was having a hard time breathing. But like none of those things looked like, if you looked at the whole picture, none of it looked crazy, right? Like I was dealing with so much change, like environmentally and in my body, that by the time I was diagnosed, we just didn't know. So my husband left for about weeks, and while he was gone, I was napping when the boys napped, which was at the time like 2 times a day. And then you know, I was having a hard time, like just, and I just thought, well, maybe I'm just out of shape, like, especially for a postpartum mom, especially.
You're frozen. Are you going through a hot spot or something? You're frozen.
Probably. Can you see me now?
Yeah, it's more the volume though. It's kind of breaking up at the very end. We're hearing like the beginning things, but not really all of it.
You hear me?
Yes, now I can.
Okay. What was the last thing you heard?
We got to the part where you moved to Colorado. You were dealing with some things with the pregnancy that seemed like it was just general kind of postpartum things.
Yeah. So, I was putting a lot of I was putting a lot of weight on being postpartum. And by weight, I mean physical, but also like mental weight on being postpartum. So like a lot of the problem was, anything that like a mom that has just had given birth it was dealing with. I was gaining weight. I was exhausted. My kids aren't sleeping through the night. Like all of those things they didn't look like insane at the time. So my husband left for 5 weeks over the summer. So it was a year after the boys were born. My husband left for 5 weeks. And in those 5 weeks, I was having more trouble than I had originally had. And, I put that to I'm just out of shape. Like I haven't gotten used to the altitude, like that kind of stuff. So while he was gone, I actually noticed that I was gaining weight. And I was like, oh no, what if I'm pregnant again? And I was like, this is my worst nightmare. Like, what if I'm pregnant again? So I took a bunch of pregnancy tests and everything came back negative. And I was seeing rapid weight gain. And I'm not a very big person. I've got a big personality, but my body size is pretty small. I'm about 5'2" and 110 pounds soaking wet. And so watching the weight gain was pretty significant. And it was something that was noticeable at the time. And I told my husband, I was like, I think maybe I'm pregnant. Like maybe these at-home tests aren't right. Like maybe, like I don't know. But like he was like, maybe you should just work out. And I was like, okay. So he got home and I had probably put on like 20 pounds. Like it was like a lot of weight. And it was like, I know that even at my worst, this is the heaviest I've been since I was pregnant. So like it was something. So he came home. We flew back to North Carolina for a wedding. And while we were home, my dad was like, "Hey, your ankles are really swollen." And I was like, I mean, pregnant people have swollen ankles. So I was like,
Yes.
Dad. And he was like, do you really think you're pregnant? And I was like, I don't know, but like I'm gaining a lot of weight. And he was like, your legs are like pretty swollen. So I made an appointment with my doctor. I went back to Colorado. I saw the doctor and she took me seriously. And I gave it to her that she was unsure what she was looking at, but she did take me seriously. And she ordered blood work, but because of the office that I was in, they did not have access to a lab. So the lab results weren't going to be back until 2 days later, so 48 hours.
So you
that
said
was on
to
Monday.
the lab, and it was going to take 2 days for the lab results to come back. And it sounds like you said they were 48 hours. Okay, so 2 more days you had to wait.
Well, I was supposed to wait 2 more days. So I went home that afternoon. I was so exhausted. I couldn't like keep my eyes open. So I told my husband I was going to sleep early. So I actually went to bed at I remember I went to bed at like 7 o'clock that night. And I woke up the next morning, and when I went to get out of bed, I couldn't even stand up. My legs were so swollen. Yeah, so I was like, and I hate the doctor. Like even now, my doctor will tell you that I really am not a good patient. Like I'm not a good patient because I hate going to the doctor. I hate being at the doctor. So I told my husband, I was like, hey, I think I need to go to the ER. And like for me to say that I needed to go to the doctor, he was like, something must be really wrong. So I actually drove myself to the hospital because he was home with the twins. Like there wasn't a lot of options, and we had just moved to Colorado. So I was like, okay, I'll just drive myself to the ER, I guess. So I drove myself to the ER. I like waddled into the hospital, and I say this all the time. And if that nurse is listening to this one day, I hope that she knows she saved my life. So when I walked in, it was probably like 8 a.m. I was the only person there. And there was a nurse sitting behind the counter with the registration lady. And I was telling the registration lady why I was there. And the nurse just happened to be sitting there and she was listening to me. And she was like, have you ever been in heart failure? And I was like, no, like I'm 27 years old. Of course I'm not in heart failure. And that nurse was like, I think it sounds like heart failure. And she was like, why don't you come back with me? Like I hadn't even filled out any paperwork yet. And she was like, come on, let's go back here and I'll run an EKG on you while you're filling out your paperwork. So I hadn't even finished filling out my paperwork when she had finished the EKG and she had gone and gotten a doctor. And I think that nurse saved my life that day. I really do. I think that if she hadn't taken me seriously when I was there, I probably would have just sat in the waiting room forever, you know? So they had the doctor come in. I hadn't even finished my paperwork. And they're like, we need to admit you to the hospital. And I was like, why? And they were like, your EKG is pretty bad. And it's looking like there's something wrong with your heart. So they took me back to the room and then they started trying to diagnose me. They ran a bunch of tests and by the time I was there for, a few hours, they were like, we're going to admit you and you're going to be here for a while. And I was like, why? And they were like, we think you're in heart failure and we're trying to figure out why. So, I called my husband and I said, hey, it looks like I'm going to be here for a little while. And he was like, why? And I was like, I don't know. They said I'm in heart failure. And he was like, are you serious? And I was like, yeah. So I actually ended up being in the hospital for a little over a week. They diagnosed me the next day. Fortunately, they diagnosed me the next day with pulmonary hypertension. But the hospital that I was in was not like a specialty hospital by any means. So they diagnosed it as mild pulmonary hypertension and mild heart failure. They pulled two 2-liter bottles out of my stomach of fluid. I lost probably like 20 pounds in the fluid just by pulling it out of my stomach. I felt so much better. And when they diagnosed me with mild heart failure and mild pulmonary hypertension, they referred me to a specialist in Denver. Denver's hospital is one of the best pulmonary hypertension clinics in the country. So I got out of the hospital and my husband was like, hey, we're moving. And I was like, okay. So we got told that we were moving very quickly right after diagnosis. So I pushed to see the specialist before we were moving. And when I went to see the specialist, they were like, hey, we need to rerun all of these tests. The hospital that you were at isn't up to our standard, blah, blah, blah. So they admitted me to the hospital voluntarily to run all the tests. And while I was there the first night, they ran my echo and the doctor came in at like 8 o'clock at night. And I know that they're not on call then. Or they're not they're not on then, they're on call. And it must have been bad enough that like they called him in and he came in and he was like, hey, did they tell you the results of your echo? And I said, no. And he said, well, it doesn't look good. And I was like, okay. I was like, what does that mean? He was like, I need to rerun your echo in the morning. So before they had even brought in blood work, they ran another echo in the morning and the doctor came in and he said, and I was pacing the room and he said, so do you want to sit down? And I said, no. And I said, you can tell me standing up. And he said, so your echo's really bad. And he was like, so they diagnosed you with mild pulmonary hypertension and mild heart failure. But from what we can tell from your echo, you have severe pulmonary hypertension and severe heart failure. And he was like, and if you don't start treatment immediately, you're going to die. And I'm just looking at him and I'm just like, are you serious? And he was like, from the way your echo looked, I'm shocked that you can even stand right now.
Oh my goodness.
Yeah. And I was like pacing back and forth. And he was like, so your body has like compensated for the heart failure that you're in. But like, he was like, your condition right now is really severe. and we need to start you on treatment immediately. So that day I went in for a right heart cath, and then the next day I started treatment. I started a pump immediately, and then
So what was the treatment? What treatment did they put you on?
they put me on IV Remodulin.
Okay.
So they started treatment. I was in the hospital for like 2 weeks instead of the 3 days they told me I was going to be there. And then I got discharged, and then a week later we moved to Alabama.
Oh my goodness. So what was that? So I want to pause and pivot. What was that like? Because you were finally getting the treatment that you needed to live, and then you had to move to another area. So was there a transfer of care to the next facility? Did you have to figure it out on your own? Because I know with my mother, we called in advance, but I had to figure a lot of things out. So what was it like for you?
It was really difficult. So they actually tried to get me to stay. They were like, do you have to move like next week? Like, can you just stay? And I was like, I mean, I could stay, but like we don't have family here. Alabama is closer to our families that are East Coast. I was like, I mean, it doesn't make sense to stay, especially because my husband is my caregiver now. Like, we have twins, like he's in the military. Like, we just don't have the capacity for me to not be with the family. And my doctor was really upset. He was not stoked. He was like, we know doctors in Alabama. He was like, but we would prefer you go, to like Mayo in Florida. And, it was weird because like at the time, I didn't know anything about crossing state lines with insurance. I didn't know anything about like what care was important and what wasn't important. And what was really difficult was that I just had to figure that out, trial and error, right? So we moved to Alabama, and they referred me to a specialist, and I hated her. She is very big in the pulmonary hypertension world, and it wasn't good. It wasn't a very good. We didn't take off on the right foot. So I transferred care as soon as they transferred me to her. I transferred my own care somewhere else.
Okay.
But in hindsight, it's 2020, right? So I was driving 4 hours to Birmingham when I could have been driving 4 hours to Mayo, and the level of care is, I mean, they're not even on the same freaking planet. Yeah. So if I had known that I didn't need to stay in Alabama, I could have driven to Florida. Life would have looked a lot different for the next 2 years, because we were in Alabama for, almost 2 years, and I was in the care of a bunch of doctors that had no idea what they were doing. So in the 2 years that I was in Alabama, I was in the hospital 6 times, and I almost died twice.
Yeah.
So, and it's one of those things where it's like, it would have been really helpful if somebody had explained to me, you can go wherever you want, and your insurance will probably still cover it. Like, yeah. I just didn't know any better. And then like,
now go back, Gerry, because your story sounds common. It's very parallel to what we experienced. So help me to understand, like you said, when you're in the hospital 6 times, you almost died twice. I understand that. But did you find that there were points that you had to learn how to start advocating for yourself and educating the team? Because, it's an orientation to a world that people don't truly understand. So can you tell us just a little about that healthcare part, and then come back to where you were at? But I don't want people who don't understand the community to miss that story is common.
Yeah, absolutely. I was very fortunate being in Colorado. I did not feel like I had to push for good healthcare. Being in Alabama and realizing that like things weren't exactly on the same page as where I was in Colorado, and coming from like that high level of care and then being in care that wasn't as like good, I guess, was interesting. And I think I realized, and I mean, that's my personality, right? Like that's a Scorpio, that's an Enneagram 8. Like yeah. I'm a big personality, and I have very strong opinions. And I think it's just one of those things where I was just like, well, that doesn't make any sense. And I wanted to know why it didn't make sense. So I started asking questions. And luckily for me, my relationship with my Colorado team, so like even now, almost 4 years later, Colorado and I still talk. We talk all the time. So it was very lucky for me that I had a team in Colorado who had my back. So when I reached out to Colorado and I said, hey, this is what happened, and I had a really bad experience, they said, you don't have to go there anymore. Like, go somewhere else. And I was like, I can do that? And they were like, yeah. So it was really helpful because I had somebody to bounce an idea off of who I respected and who had also just saved my life. So then I started realizing, like, I don't have to do these things, and I'm in charge of my own, like, I'm in charge of my body. Like, they're making suggestions on treatment, but like they don't define what the end all be all of treatments. And it wasn't something that like you learn, at school. It was something that I had to learn as a lived experience, right? So like realizing that, like, even though they are the professionals, they don't always have final say on what I do, because they'll be, doctors will suggest treatment and then they'll say, is that okay if we move forward? And I could say no. And that was something that was really important. And that had to be put into practice in Alabama. So I got better on the IV Remodulin. Even with all the hospital visits, I was getting better. And because of Denver's treatment and because of the way Denver approached my condition, I got better. And I was having such an issue with my IV line that Alabama suggested that I come off of the pump and go to an oral medication because I was that much better. And moving from IV to pump, or moving from IV to oral doesn't happen all the time. And I remember asking Alabama's team, have you done this before? And they said, oh yeah. And then I started realizing that they hadn't really done it before. And I was like, well, this isn't a good sign. So I was in the hospital and I called Denver and I said, hey, this is what's happening. What do you think? And they were like, they were kind of like, no, I mean, you can do it if that's what they're suggesting, but I would be cautious. So with that in the back of my head, we moved forward with oral treatment. And come to find out, I wasn't put on the right dose. And then on top of not being put on the right dose, I ended up progressing, going backwards, ended up back in heart failure. And they tried to take me off my medicine altogether. And for pulmonary hypertension, you don't come off the meds. Like, you stay on the meds your whole life, right? And I had a doctor tell me that she was the doctor. She was like, I'm the doctor here. And I said, I get that, but you're not my favorite doctor by any means. And you don't know what you're talking about. And she told me that if I needed a second opinion, that I didn't need to be their patient anymore.
Oh, no. Gerry, oh my God, I'm so sorry that happened.
It was insane. And at the time I was just like, who do you think you are? Like, there are 100 doctors out there and I can pick any one of them. And at that point I knew, right? I knew I didn't have to stay there. So when she said that, I was like, that's fine. I will start looking for other options. So luckily for us, the timing worked out and we were moving to Florida at the time anyway. So I went to Mayo. I called Denver. I said, who do you recommend? They said, go to Mayo. I ended up at Mayo. That's where I am now. That's where I'm going right now, actually. I ended up at Mayo and they looked at my oral medication, and then I told them that Alabama was trying to take me off meds, and they were like, oh no. They were like, that's not what you're supposed to do. So then they did a heart cath, did all the intake, and realized that I was in pretty bad heart failure. And this was 2 years ago, and I ended up back on pump because I was so sick and I didn't even notice it again. So instead of coming off my meds altogether, I ended up on a more extreme med because I went back to pump. And Mayo saved my life a second time, but they confer with my Colorado team even now. So I got a bad echo report in November, and my doctor, as humble as he is, bless him, he was like, let's call Colorado and see what they say. And that's the sign of a good doctor, is to know that like he isn't always the expert, right? Like he is an expert in his field, but he's so humble and has no problem getting a second opinion. So we called Colorado's doctor while I was sitting in the office so that they could go over it together. Like, are we all on the same page? So that I knew that I was getting the best treatment for me, and it was coming from two doctors who know me and know that I'm not a number, and doctors who like talk to me all the time, doctors who know my family, they know my kids' names, they know my husband's name, and that was so important to me. And like I realized that I made the right decision, because Mayo has been great, and it's only because their doctors are like humble, and they aren't doctors who, because they have the white coat on, think that they know better than what the patient does.
Absolutely, absolutely. So I want to go back when they wanted to switch you from the pump to the oral medication, they started to kind of titrate down on the medication from the pump and then increase it. So they're trying to find this balance. Did you experience any of the symptoms like the nausea, the vomiting, the ringing in the ears? What were some of the symptoms where you knew that transition wasn't working?
I didn't know. So I didn't have any symptoms. I was like pretty good. I mean, they titrated me down off pump and then transferred me to an oral. And the transition actually wasn't that bad, and they did it really quickly. So over 3 days in the hospital, I transferred from IV to oral. Yeah.
Wow, that's almost unheard of in the PH community for it to go that's shocking that it was done that fast.
Also, it showed that they didn't know what they were doing, right? Like they were just winging it. And what sucks is that like somebody has to be the first, right? Like I'm in a clinical trial right now, so like somebody has to be the first. But like when it comes to that kind of a situation, and like the pump is keeping me alive, I feel like it probably shouldn't have been me, but like it had to have been somebody.
Right.
So it was not ideal, but I didn't have any symptoms at transition. I actually did pretty fine. I didn't have any oral side effects until I had been on the oral medication for a couple of months, and I was miserable. I'm on subcutaneous now and not IV because of my skin issues, but the oral medication was brutal. I was like nauseous. I had nonstop GI problems. Like I almost needed to start seeing a GI specialist. My stomach was so messed up.
Yeah.
I had headaches all the time, and I was just so miserable. Like I would have taken the pump any day. So when they offered pump again, because I was failing orals, when Mayo offered me pump, I said, yeah, let's do pump. Because they also offered me, they said, you're not getting the right dose. They didn't think I got a fair shake. So they were like, you didn't get a fair shake at oral. And if you don't want to go back to the pump, we can try oral on the right dose and see if you respond to treatment. But because of the condition that I was in when Mayo got me, I was in pretty bad failure. My numbers were worse than they were at diagnosis. But I felt fine, right? So they were like, if you try oral, and this is what my doctor said, he said, if you try oral and it doesn't work, I can't guarantee that the pump would at that state. So basically he said, if you don't go pump, I don't know if I can bring you back. Like, I don't know if we could get better if you keep progressing, you know what I'm saying? Like, you might be too far gone. So I was like, no, let's go pump. If you know that that's going to be the treatment that works, I want to do whatever works. And, my doctor is great because he's thinking of my family, right? He's thinking, you have kids, you want to be there to see them graduate from college, He was like, the best treatment option right now for you to be here long term is to do this. He was like, we can do this. He was like, I just can't guarantee longevity that way. You know what I mean?
Absolutely. And so I asked that because, like you said, some of those side effects, people don't understand that it's because that you're not on that right dosage. You know, like you said, the headaches, the nausea, the vomiting, the ringing in the ear, all those things, they miss that. And then they go down this path where providers then start linking them to more providers, but they're still not getting the care that they need for the pH side for it. And I want people to hear your story, to hear that you truly are a pH fighter and you advocated for yourself, and you were so just blessed to have this amazing team. So tell me, what is life like today? And when you had the IV, where was your port site? Where was your site at for the different times where you had the pump?
So the IV, normal practice, and there are a lot of doctors that don't do it. Normal practice is central line right here to your heart. The doctors, when they put in my second line, because my first one got infected, they put one here, but it wasn't the right type of line. I don't know. My Mayo doctors were like, why did they use that? And I was like, I don't know. So both lines were right here. I'm on subcutaneous now. So currently this is where my port is. So I change it probably every 6 to 8 weeks. I'm at almost 7 weeks, which will be my longest site Sunday. So I know I've been dealing with a lot of skin issues. So at my last echo, which was actually like 3 weeks ago, numbers looked a lot better. And I'm on a clinical trial too. So they can't tell if it's the clinical trial med that I'm getting, or if now that my sites are actually lasting and they're lasting longer, that I'm getting more medication than I was before. So it's been a year and a half of like trial and error with this pump specifically. But if you add that in addition to the clinical trial, I'm doing a lot better. I have a heart cath coming up in August. It will be my 10th heart cath, which is, terrible, because some people go, 15 years and only have 3, but I've had 10 in 4 years. But this heart cath will hopefully, let us know where I am on the trial, like if I'm getting drug or not, because right now it's a double blind, so we don't know if I'm getting drug. But I will be rolled over to drug in September.
Okay.
The idea is that the pressures and the PVR in my heart will have, gone towards the good numbers, because right now they were escalating, which is why in November I had a bad report, because they thought that I was progressing. But turns out I'm pretty stable right now, and they're hoping to see good progress in August. So far right now I'm doing pretty well.
Very good. So what other things are you just doing in general, just in your life? Because you're here for a reason and you're doing amazing work. So are you doing anything to help increase awareness of pulmonary hypertension in your community?
Sure. I do a lot of legislative work behind the scenes. I've spoken to a bunch of senators in Congress about changing laws that affect people with pulmonary hypertension, especially centered around drug costs and insurance costs. I am speaking at Pulmonary Hypertension conference this weekend. I'm speaking tomorrow. I'm speaking tomorrow and Saturday, which is super exciting. One of them is about self-advocacy. I'm speaking at 2 other conferences this year. One is a chronic illness conference, and one is a Christian conference. So
Always going out, Gerry, and I want to hear those conferences. We heard that the other conferences that you have coming up, and it's 2, but we could not hear those last 2 that you said, and I want people to hear those conferences.
Speaking at a Christian conference in August in Atlanta, and then I'm also speaking at Healthy Voices, a wellness conference in September.
Awesome, awesome. So is there any, hold on one second. So we have you back and we got great reception now. So moving forward, what's next for you? Where do you see yourself in the next 5 years?
I would like to like hone in on speaking a little more. So I've got 3 conferences this year. The goal for next year is 5 conferences. So we'll see how that goes. I'm consulting with pharma on like pulmonary hypertension, like patient facing like stuff, which has been really cool. So I would like to keep doing that. And something that I'm playing around with in my head is maybe a nonprofit, but I haven't exactly worked all of that out yet. So that's still in the working progress in my head. So hopefully in the next 5 years, I would be able to, iron out a lot of those things.
Well, if anyone can do it, it is definitely you. As we close out, I want to say thank you so much for being here, for sharing your story. And once you're part of our family, like you're stuck with me for a while. Are there any closing words of wisdom? Our mantra is awareness, empowerment, and hope. Together, we can make a difference. And I started that in honor of my mother, the late Roberta Baines Wheeler. But are there any final words of encouragement or inspiration that you would want to share with patients, caregivers, providers, or just those who are watching as they think about the pulmonary hypertension community?
Absolutely. Because pulmonary hypertension is such a rare condition, there's not a lot of information out there. So a lot of people that come to me ask about sharing their story, and I do think that sharing your story is really important. Sharing your story helps create empathy, which creates change. So if you're not sure about sharing your story, I encourage you to get out there and start sharing, because together with a bunch of voices, we can actually make change for the community.
Thank you so much for being here. We truly appreciate you. Now, will you promise us in a couple of months or next year, can we have you back on to see how things are going with you? Because I want to hear more about your journey and everything that you're doing.
Absolutely. Anytime, you let me know.
All right. Thank you. I'm so excited. All right. So everyone, so until next time, you have heard and met the amazing Gerry Langan. I am Dr. Catherine Y. Brown. Stay tuned because we have so many more voices for you to hear and connect with. Have a great day, everyone.